All right, let's get into it. Today, we're taking a look at some fascinating, kind of raw and personal study notes from a medical student. And what we're going to do is pull out a powerful strategy from them, a way to tackle those high stakes clinical exams. Look, this isn't just about memorizing facts, it's about building a completely bulletproof mindset for test day. And really, it all kicks off with this one simple idea, which was captured perfectly in the original notes: the difference between thinking and overthinking. I mean, that is the central battle every single test taker faces, right? These notes are basically a blueprint for how to win that battle, how to think clearly and strategically when everything's on the line. Okay, so first things first, we've got to be real about what these exams are. They are not just a test of what you know. They are a massive psychological game. The pressure, that voice of self-doubt, the fear, it's all part of the challenge, and it's something we have to learn to manage. Now, what's so cool about these notes is how clearly they nail these mental traps. You know that little voice in your head that tells you to pick an answer you haven't even really revised? Or that gut-wrenching fear of choosing an option that looks unfamiliar even when all the logic is pointing right at it? And of course, there's the clock, always ticking, always pushing you to rush. So the million-dollar question is, how do you actually develop a system to cut through all of that internal chatter? How do you build a process that holds up when you're under some serious stress? Well, that's exactly what we're going to break down right now. So let's get into our first course strategy, and honestly, this is the foundation for everything else we're going to talk about. You have to see the real question that's being asked. That is job number one, your most important task, before you even think about the answers. And these notes lay out a really simple but super disciplined process. It's not rocket science. Step one, read the entire question. Don't skim it, read it. Step two, read all of the answer choices. Then, step three, go back and reread the very last line of the question. You know, the part that says, what is the most likely diagnosis, or what is the next best step? This little three-step dance forces you to focus on what they're actually asking. And here is a huge warning that comes right out of that process. You have to stick to the information you are given. The notes put it perfectly: don't invent a natural history for the disease by yourself. If the facts in the prompt don't support some story you're telling yourself, you can't just make it up, no matter how tempting it feels. Okay, so that idea flows right into our next big skill, learning how to separate the signal from the noise. In any clinical problem, you're going to have hard facts, and then you're going to have stuff that's just there to throw you off. Your job is to know the difference. So what's the signal? Well, as the notes point out, the lab, the numbers, will guide you. It's the objective stuff, the vitals, the lab values, key physical exam findings like dry mucous membranes or warmth and effusion. And the noise? That's everything else. It could be a misleading risk factor, your own assumptions, or those patient histories you're tempted to invent in your head. And the source material gives us a perfect example of this. A patient's risk factor? It's just a clue. If it doesn't line up with the hard data, the labs, the exam findings, then it might just be a distractor. Think about it. A baby with central cyanosis. The main signal there is congenital heart disease. Even if the baby also has a risk factor for something like sickle cell, the hard data wins every time. All right, we've set up the mindset. Trust the data. Now let's put that into practice with a few high-yield clinical pearls where it's really easy to get tripped up. Think of this as a lightning round of must-know connections that can grab you some easy points. First up, you see a patient with unexplained atrial fibrillation. The cause isn't obvious. The test writers are almost always pointing you in one direction. Your automatic go-to move should be to check their thyroid-stimulating hormone, the TSH. Okay, next one, loss of consciousness, or LOC. This is a classic test of that whole thinking versus overthinking problem. When a patient faints, your default diagnosis is syncope. The notes are really blunt here. Don't get trapped inventing rare, crazy causes. Start with the simplest, most likely answer, syncope, and let the data prove you wrong. Now this one is a critical safety checklist, HIV vaccination rules. Patients with HIV need several key vaccines. You can see the whole list here: Hep A and B, HPV, Tdap, and a few others. But honestly, more important than memorizing what to give is knowing what you can never give. The absolute ironclad rule is this: you never, ever give live attenuated vaccines to any patient who is immunocompromised. That's a point you just can't afford to miss. This table here shows a classic chain of events that you will see all the time on exams. Just look at how the puzzle pieces fit together. A patient has a stroke. That leads to hemiparesis, which is weakness on one side. That weakness can cause dysphagia, trouble swallowing. So when a patient who can't swallow properly then develops pneumonia, your number one diagnosis has to be aspiration pneumonia. It's a direct cause and effect chain that gets tested constantly.
So, those clinical pearls are all about seeing patterns in the data. But what happens when the biggest distractor isn't even in the question? What if it's in your own head? That brings us to our final and maybe the toughest challenge, conquering your own bias. This really is the final boss of test taking.
And this line from the notes is just so powerful. Your insistence on something doesn't mean it's right. You probably have a bias. Think about that. That feeling of absolute certainty, that gut instinct that you are 100% correct about an answer, sometimes that can be your greatest weakness. It might not be logic. It might just be bias. So the key takeaway here is you have to find balance. You have to literally force yourself to take a step back and think about the big picture. You have to consider all the evidence, not just the little pieces that confirm your first guess. It's about pulling the whole case together, the background, the labs, the exam, into one coherent story. And that brings us right back to where we started, to the one question you have to keep asking yourself during your prep, and especially on exam day. How will you know the difference between sharp, strategic thinking and the dangerous trap of overthinking? Mastering that distinction, right there, that's the real key to unlocking your potential.